In this video, I'm going to explain what to expect during a dentist checkup. In a separate video, we have a full example from start to finish of a real life checkup. So if you want to watch that and see what a real checkup looks like, then you can do so. In this video, I'm going to go through all the different steps. I'm going to explain to you why we do the things we do, what all the different things mean, such as when the dentist is speaking to the nurse in that code, what it all means, so that you know exactly what to expect when you go for your checkup. Before we begin, I do want to make it clear that lots of dentists will work in different ways. So what I'm going to explain is a general overview of how dentists work. Not every dentist will do every step. There's a different variety. So some dentists may perform a more basic checkup. Some dentists who work in higher end clinics will perform a more thorough, detailed checkup. Appointment times last between 15 minutes or an hour, depending on what type of dentist you go to. Once you've booked your appointment, most practices will probably send you a text or an email. They'll explain where the clinic is, how to get there, whether there's parking. A lot of practices may take a deposit to secure your appointment, and they'll explain exactly in what circumstances you will and won't get that deposit back. So make sure you're clear on that in case you need to reschedule. A lot of times you may need to give up to 48 hours notice before rescheduling an appointment, but make sure you clarify that with your practice when you're booking your appointment. There's likely to be a few registration forms. So you get information such as your name, your address, your contact details. There'll probably be a privacy form as well, which explains about data collection, what data is kept and how the data is stored. And then one of the most important things is also a medical history questionnaire. Make sure that you're honest with your dentist and write down your medical conditions, the drugs you're taking, any medication you're on, any treatments you've had. Just answer all the questions in as much detail as possible. It is personal. It is your medical info. You do not have to disclose it to your dentist. However, there are a lot of conditions and a lot of medications that can impact dental treatment. So there's certain things that you might be taking or certain illnesses you may have that might affect what is and what isn't appropriate for you. A dentist who understands your overall medical health will be much better positioned to help you tackle any dental concerns as well. Your dental checkup will start off with a conversation between you and the dentist. The dentist should understand exactly what your concerns and questions are, and the dentist will also explain what's going to happen in that process. They'll go over your medical history form to make sure that everything is clear and correct. This is the opportunity you have to tell your dentist what your problems are, if you have any, and also any questions you have. So at this point, make sure you don't hold back. There's no silly questions. Anything that you're wondering, like even if it's as simple as like when should you brush your teeth, or a pain that you felt a week ago that you're not sure is significant, tell your dentist everything at this point so that they know exactly what to look for during their examination. So the first stage of your dental assessment is an extraoral exam, checking your jaw joints, your salivary glands, your lymph nodes. We're making sure that your jaw joints are functioning properly, that you don't have any issues in the movement of your jaw and chewing and speaking. Then we also check for any swellings of your salivary glands and lymph nodes to make sure that your overall health is okay. And it also forms part of our cancer screening that we do for everybody. So swollen lymph nodes and glands can indicate underlying illnesses. And if your dentist picks up on this, they'll discuss what you need to do going forward. But every dentist, every checkup should involve an extraoral exam and a cancer screening. The next step is to check your soft tissues. Open really wide. So checking all your soft tissues now, right? So your cheeks, tongue, the floor of your mouth, the roof of your mouth. So we do a cancer screening. So stick your tongue out for me and into your right cheek and into your left cheek, and curl your tongue up for me there and relax. Cool. It's all looking fine. There are a large number of illnesses and diseases that manifest on the soft tissues of your mouth. So your dentist will be doing a screening to make sure that everything's okay, and also looking for signs of oral cancer as well. Once the cancer screening and soft tissue check is done, your dentist is probably going to proceed with a charting. This is the typical thing where the dentist starts speaking to your nurse, calling out loads of numbers and things. 7, 6 fissures sealed, 5, 4, 3, 2, 1. Lower right, 1, 2, 3, 4, 5, DO composite. And what we're doing is we are creating a chart of your teeth. So we're writing down which teeth are present and which teeth are missing, what fillings are there in your, and also a note on the condition of those fillings. Signs of decay, we're looking for cracks, cavities, signs of tooth wear, signs of gum recession. All of this information, your dentist is going through your teeth one by one. They'll use a little bit of air just to dry the teeth so they get a good picture and they can see properly. They'll be telling their nurse what everything is, and the nurse will be writing down the condition, and that forms your dental record. So the next step of your checkup is a BPE, or a basic periodontal examination. This is a gum disease screening. So BP, upper right's 1, upper central's 2, upper left 0, lower left 0, lower central's 2, and lower right's 0. The dentist takes a really thin ball-ended blunt instrument and they'll press it gently against your gums. We're looking to see if your gums bleed when we gently touch them. We're looking to see if there's any pockets around your teeth, and a pocket is where the gum is really loose, and we'll score your gums on a scale of 0 to 4. 0 is a perfectly healthy gum. 1 means that there's a little bit of bleeding. 2 means that there's a little bit of calculus or an overhang or a rough edge of a filling or a crown in the area that needs to be polished or cleaned. 3 means there's a pocket and that we need to keep an eye on that area or treat it for gum disease. 4 is a deeper pocket, and that usually means that you have advanced gum disease that requires attention. There is nuance to all of those codes and more context is needed, but your dentist will explain that. This is the part where you'll see a lot of memes and comments about how, oh, your dentist stabs your gums and they made them bleed. Really, we're not stabbing them. The instrument's completely blunt. We're just putting a little pressure on the gum to see if they bleed. A healthy gum should be able to withstand the pressure. If it is painful or uncomfortable for you, make sure you tell your dentist. It might feel like a bit of a weird sensation, but it definitely shouldn't be painful. What a dentist can't see from just visually looking at your teeth is in between them or underneath the gum line, or they can't fully see cavities that might be inside the tooth but may not have come to the surface yet. So the dentist will take x-rays. So open really wide. Cool, and close together for me there. Brilliant. So just stay really still for a few seconds.
I don't know why it's always really scary when I get an x-ray and you leave the room.
Yeah, we're like, we're sheltering ourselves. Open really wide and close together. Yeah, it's like, it's safe for you to have every so often, but not for us to have all day, every day. Based on your charting and the condition of your teeth, the dentist will decide what kind of x-rays to take. Typically, they'll take Bitewings, which is an x-ray on one side and the other side. They show the bone level of your back teeth, and they'll also show if there's any cavities in between your teeth that your dentist can't see visually when looking in your mouth. If you've got things like crowns, implants, or deep fillings, or if you have specific pain on certain teeth, the dentist might also take a PA. A PA is an x-ray of the roots of your teeth, so we can check if there's any infections or signs of nerve death or anything else. The other main kind of x-ray you'll probably get at a checkup is an OPG. That's when you have to go to a machine and get a full picture of the entire jaw. That's taken in certain situations, for example, to assess wisdom teeth. If we can't see them on like a normal, smaller x-ray, we'll use those in patients that either can't tolerate the x-rays if they make them gag or if they're too uncomfortable, or if we need to see like a bigger picture in certain situations, like and visualize things like sinuses. But usually the smaller x-rays are the more detailed ones, so we'll try and take those, and if needed, we'll take an OPG as well. So the things mentioned so far, the cancer screening, the charting, the gum disease screening, they're just an absolute requirement for any dentist to do at every checkup. Sometimes if you've been to a dentist numerous times in the past, the charting can be quite quick because they've already got it on file and they just need updating it. But they are the sort of core principles of a dental examination. A lot of practices will go on to do things like take a digital scan of your teeth. Digital scanners are amazing. They've completely changed the way I practice. It's a little camera that goes around and creates a 3D model and a recreation of your teeth. It allows a dentist to create an accurate record of what your teeth are like. We can use those models to then 3D print things like aligners, mouth guards, retainers, whitening trays. If you have a trauma, if you break your teeth or lose your teeth in the future, we can use those scans to print your teeth and then create bridges, crowns that shaped exactly like your natural teeth. And it also allows you to see exactly what your teeth are like. A lot of dentists will then also take pictures or high resolution pictures of your teeth with specialist camera equipment. Again, it just adds to the more precise documentation, and these things can also be used to create treatment plans and reports to help you understand your dental condition and what treatment's needed. Once your dentist has done assessing your teeth and documenting everything they need to do, at this point your dentist should explain everything, your gum disease risk, if there's any cracks, cavities, tooth wear, gum recession, issues that they find with your bite, and then also discuss your treatment options. So they'll explain what is important, what isn't important. They should explain what's urgent to fix, what can be done later down the line. You can also talk about cosmetic options if you want to improve the look of your teeth, the color, the shape. You'll get a chance to speak to your dentist in a bit more detail about what treatment is required and what your options are. You can, at this point, you should also discuss things like pricing or any initial questions that you may have. Sometimes, if it's a really complex treatment plan, Dentists may follow up with a more detailed treatment plan later, but most of the times you'll be given a pretty straightforward plan of action. They should provide you with a written treatment plan with costings of all of their recommendations. So this can be done if it's really simple, they'll do it straight away and they'll give it to you before you leave the clinic, or they may need to follow up with you via email. Some dental clinics, you'll get a very basic treatment plan, which is a list of recommendations and their pricing. Other clinics might give you a more detailed report with all the recommended treatment, your alternatives, follow-up information, the pictures, the scans, the x-rays. Some dental practices will highlight those and annotate those and explain things for you as well. This is one of the examples where there's a difference between sort of basic or higher end dental practices and the level of service they provide. You'll always get some kind of written treatment plan. How detailed and how helpful that is will depend on the kind of dentist that you're going to. You should also be given your recall period. You don't really have to see a dentist every 6 months. That's quite an old school way of thinking about it. How often you come for your checkups is determined by the risk status of your teeth. So if you've got several fillings, you've got lots of decay, or you've got gum disease, or there's a lot of things going on with your oral health, you may need to have a checkup every 3 months or every 6 months. If you've got perfectly healthy teeth, you look after them well, you see the hygienist regularly, and there's not a lot of maintenance needed, you may only need to go to the dentist every year or every 2 years for your checkups. Your dentist should give you a recall period, which tells you what their recommendation is on how often you need to come back to see them. So that's an overview of what happens at a dental checkup. If you have any specific questions, you can ask me in the comments below. If there's anything I've missed or just things that your dentist did differently and you want clarification, then let me know. If you've been given a treatment plan and you have further questions and you're not fully sure on what to do, you can contact your dentist directly. They should follow up with you and help guide you in making the right decisions or give you the answers that you're looking for. If you're still confused and you want to speak to someone who's impartial from the process, you can contact one of our online dentists at novasmiles.co.uk and they'll be happy to guide you through your treatment plan and give you a bit more explanation on what's what.